Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you the core set of exercises that would make up your home exercise program after knee replacement surgery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our videos related to knee replacement surgery. So these are really the core or the main exercises that I give to the vast majority of people. And usually they're applicable for, those first 4 to 6 weeks. Around 4 to 6 weeks, or probably maybe even a little before that, you're probably, hopefully if you have a good therapist, are progressing to really some more functional, some more dynamic exercises, some more specific exercises to your needs and challenges. But this is really some of the core foundational exercises that I would say 90-95% of people will have to perform after surgery. So not wasting any more time, let's jump into it. First thing we have are quad sets with your legs out straight, sitting up or lying down. I like to put that towel roll under my leg. And all you're doing is pushing the knee down. Hold that contraction, feel it in your quadriceps, 5-10 seconds, and then relax. Real simple exercise, but early knee extension range of motion, working on early quadricep strengthening muscle contraction as well, and relax. Usually do about 10 repetitions, holding 5 to 10 seconds, and you can do 1 to 2 sets, especially early on after surgery. Doing it maybe 2 or 3 times a day is really helpful. Then we have heel slides. So you can use a stretching strap, rolled up towel, rolled up bed sheet, but you can still perform this exercise even if you don't have them. If you have that strap or bed sheet, you put it around the ball of your foot. You can do this lying down or sitting up. Sliding your heel toward your bottom. Get to where you get that max amount of flexion. Give an extra little pull, and then just relax back down. All the way up, then give a little pull at the end, try to get a little bit more bend, and then relax back down. Usually I'll do 2 or 3 sets of 10 to 15 repetitions. Again, early on, 2 or 3 times a day, and then going down to maybe once or twice a day as you progress in your rehab. Next we have, I call these sciatic nerve glides. You may hear them called other things, but basically you're flexing your hip up, hugging underneath your thigh, around your hamstring. You're going to start in this position. Try to bring your foot all the way up toward the ceiling, trying to straighten the knee as much as you can. You probably won't get that far, or you won't get perfectly straight because you'll start to feel that hamstring pull, although some people can get straight. Once you get to as far as you can, just slowly and controlled let it come down. Let your knee bend as much as you can. Try to bring your foot toward your bottom. And then alternate back and forth. Usually doing about 10 or 15 repetitions. 1 or 2 sets. We're also focusing on strengthening our hips, our glutes, to help with function, mobility, return to activity. Real common one is bridging. Having your legs bent up. Do a little bit of that pelvic tilt to help activate the glutes and decrease stress through the back. So trying to flatten your low back before you start and feel that pelvic tilt. And then you're just lifting your hips and pelvis up toward the ceiling and back down. Slow and controlled repetitions. Usually doing 2 or 3 sets of 10 repetitions. You can add progression to this. You can put a TheraBand around your legs. You could do single leg. There's a lot of different variations and ways to progress the standard bridge. The next one I want to go over are clamshells. So if you can tolerate it, lying on your side, hips and knees bent to about 45-degree angle, legs stacked on top of each other. Keeping your feet together, you're just going to lift this top knee up. Don't go too far that you're rotating your hips and pelvis and your back. So I like to hold my hand here as a cue. going about there and back down. 2 or 3 sets of 10 repetitions. You can use a TheraBand loop around the legs to give a little more resistance. Always good to perform on both sides. If you can't tolerate lying on your side like this, you can always lie on your back. Put the TheraBand loop around your legs still to give you that resistance, and just pull in the knees and legs apart from here as well. Alright, and now we're going to transition to some seated exercises. So exercises from a seated position. First one is seated knee extensions. Straightening the knee all the way up and then back down. Once you have full knee extension in this exercise or this position, you can add some ankle weights to add a little more resistance and strengthening. Usually doing about 2 or 3 sets of 10 repetitions. Slow and controlled on the up and the down. We can do seated heel slides or seated knee bends. Start with the leg a little bit out in front of you. Slide that foot back as far as you possibly can. You can use your opposite leg to give a little more push, and then let it come back out. And you can wrap your opposite leg around the leg to help it back out as well. So again, bend as far as you can. Give an extra little push with your non-surgical leg, and then slide the leg back out. So those are seated heel slides or seated knee bends, working on that flexion or bending range of motion. From the chair, we can do our sit to stands. So try not to use your arms if you can. If you need to early on, or if you're having a little bit of weakness or from a lower chair, you can use the arms, but trying to work to where we don't need to use them. And you're just going to try to go up, straight all the way, slow and controlled back down. Usually doing 1 or 2 sets of 10 repetitions, all the way up, all the way down, slow and controlled. Trying to keep your back in that straight, neutral position as you do this. And then also there's exercises in standing. So there's all sorts of things you can do, but some of the most common, we can do some standing marches. Usually for standing exercises, I'll recommend doing them standing at your kitchen counter or your kitchen sink so you have something really sturdy to grasp onto. We can do some hip abduction, so going out to the side, doing 10 or 15 repetitions for both legs. We can do going backward or hip extensions, 10 or 15 repetitions for each leg, slow and controlled. Standing knee flexion, so now bending your knee, bringing your foot toward your bottom. 10 or 15 repetitions each side. Heel raises, going up and down on your toes, strengthening your calf muscles. As you progress and if you get nice and strong, you can try single leg heel raises. You can also do toe raises, strengthening some of the muscles on the front of your leg and your shin. You can also do supported squats. So this is where I really like having that sturdy kitchen sink, because you can grasp onto it and sit back into your body weight squat or your partial squat. Working up to about 10 or 15 repetitions. Again, focus on being slow and controlled, working on good technique. A lot of times I'll see people, their knees will really come forward and they'll put a lot of stress and strain through their knees and their quadriceps. And it tends to be a lot more tolerable and better if you're sitting back, almost like you're sitting back in a chair, bringing your bottom back as you do your body weight squats up and down. You can do lunges, staggering your feet, trying to keep your back up straight and neutral, just coming down and back up. Going as far down as you can tolerate, trying about 10 or 15 repetitions at a time on each side. We can do side stepping, so getting in a little bit of a squat position. You can put a TheraBand around your legs to give it a little resistance with this. Doing your side stepping back and forth. And then also a very common exercise that I give to the majority of rehab patients is going to be step-ups. So with step-ups, just doing stairs in general, the recommendation up with the good, down with the bad. So up with the non-surgical and down with the surgical leg leading. When you're doing step-ups for strengthening, you want to do both sides. So leading with both sides going up and with going down. Definitely have a railing or something to hold on to for support, especially early on as you're regaining your balance and stability. But just getting your full foot up on the step, stepping up and back down. And doing 10 or 15 repetitions for both legs leading as you go up. And then of course the opposite, stepping down. You know, you can do it this way if you're really trying to be fancy. There's a lot of different variations with stepping, but I also like to do lateral stepping or side stepping. So again, I usually have something in front of them, a railing to hold on to for support, stepping up and back down, and doing about 10 repetitions for each side. And then probably one of the most important exercises that you can do is just walking. So getting out and walking throughout your home, walking outside or someplace, going someplace in your community to walk inside, just getting your body moving, building up some aerobic health, building up some pain and activity tolerance. Very, very important exercise as well. So definitely I include walking as part of the home exercise routine as well. So I hope you found this video helpful and insightful. That's my comprehensive list of home exercises that I give to probably 90-95% of my patients. Of course, there's other exercises and other variations that I will give depending on the patient and their goals. But this is really the main meat and potatoes of a rehab home exercise program for someone with knee replacement. Be sure to hit that like button. Be sure to leave your questions and comments below. As always, please be sure to hit that subscribe button and turn on the notifications. Thank you for watching.